Hi, thank you for joining us. My name is Alonzo South. I'm the Assistant Vice President of Community Impact here at the Children's Hospital of Philadelphia, and I'm thrilled to have with us today Dr. Tyra Bryan-Stephens, CHOP's Chief Health Equity Officer and the lead for our Center for Health Equity. Dr. Tyra Bryan-Stephens, thank you so much for joining us.
Certainly my pleasure.
So, Dr. Bryan-Stephens, what is the mission of the Center for Health Equity?
So the Center for Health Equity seeks to discover, implement, and disseminate evidence-based practices that achieve the best health for children, all the children in Philadelphia. It's a lofty goal, but our mission is really to implement this through bringing hope to children so that the H is for housing, making sure that children are living in healthy housing. We also want to make sure that when they come to CHOP, they actually have opportunities for unbiased clinical care. We want to partner with others in the community who've been doing this work for a long time to address basic needs and to make sure the needs are being met. And finally, we want to make sure that children are educated in safe and healthy environments.
So I like the mission. What does it mean to actually achieve health equity?
Yes, so health equity is when all children or all people achieve their best health. So that's removing barriers. Now, a good analogy is if you think about a baseball field with a baseball fence. So with a baseball fence, if you're trying to look over the fence, if you're an adult, it's kind of easy to look over that. If you're a teenager, you might need a step stool or a crate to look over that. If you're a toddler, you can't see. So in order to look over that, you have to have 3 or 4 step stools or crates to actually look over that. So what we want to do is to make sure that everyone can see the field, has the advantages and the opportunities of the field by removing the fences, all the barriers that prevent children from achieving their best health.
There are significant inequities by race in the city of Philadelphia, and not surprisingly, Black and Hispanic children often fare the worst. And so as you think about health equity, why is CHOP committed to this work?
CHOP is in West Philly, right? And it's one of the poorest neighborhoods in the country. 1 out of 4 children have asthma. The poverty rate is, 25 to 38%, depending on the neighborhood. So the center's goal is to really focus on one neighborhood at a time, to look at all those aspects of that are social determinants, but also systemic practices. And because of the way we're organized, we're also looking from a clinical point of view, from making sure that our clinical quality and safety outcomes are really focused on looking at outcomes stratified by race, ethnicity, and payer mix to make sure there's no differences in care. We're also looking from the research perspective, how do we conduct research in a health equity manner that we're always thinking about bringing the community voice into how we design and how we implement our research. And then finally, we're looking at advocacy. We work closely with government affairs, with Policy Lab, and also with many partners throughout the city to do that.
Could you talk about the impact of giving on the Center for Health Equity? Why should people support this work?
CHOP wants to be a good neighbor, wants to be a good citizen. We have the expertise, we have the energy, we have the passion, but we need the help of philanthropy to actually make it happen. Obviously I believe this is a worthwhile cause that as you contribute and as you invest in children, we have to think about long-term return on investment, right? So children grow up to become adults that with good health, with proper education, can actually contribute to our society.
If people want to learn more about your work, where can they go?
The best place to go is www.chop.edu and search for the Center for Health Equity. And there you will find out some of the work we're doing. You can also contact us at Health Equity Center at chop.edu by email.
Well, Dr. Bryan-Stephens, thank you so much for joining us. And to our audience, thank you so much for tuning in. I hope you enjoyed listening about the Center for Health Equity and the exciting work that's happening there. That is a piece of CHOP's work in the community, whether it's in Philadelphia, Southern New Jersey, or the Pennsylvania suburbs. Our institution is committed to serving the needs of children, families throughout our region. Thank you.